Hello, everyone, and welcome to another episode of Teeth Matter. I'm your host, Ellie Halabian, DDS, and in this week's episode, we're chatting with Dr. Jossen Gastelum. Dr. Jossen is a general and cosmetic dentist out in Scottsdale, Arizona, and although he graduated dental school in 2020, he's already been featured in magazines like HuffPost and Buzzfeed. If you check out his Instagram and his TikTok, you'll see that Dr. Jossen has an amazing following. So in this conversation, we dive into questions like where does he get his creativity from? How does he build his audience? And then we get a little bit more personal, discussing what it means to represent the Hispanic community in the field of dentistry. Let's get to know Dr. Jossen. Dr. Jossen Gastelum, hi friend. Thanks for being with
Hello.
us on Teeth Matter.
I'm super excited about this. I actually heard about you through my friend Dr. Stephen Liu, and so I've been really getting forward or looking forward to meeting you because he told me a lot of good things. He said we would get along, that we were very similar. So
Oh, I love that. Thanks, Steven. Shout out to Steven. He's a great guy. And I'm so happy that he brought us together. And I know we're going to have an amazing conversation. Actually, I know you just rushed to this podcast because you were in a course. You were taking a course on case acceptance.
yeah, so I just started at a new office probably in the last like 3 weeks or so. This is week three, and so the owner of the office is very interested in continuing education and just making sure that we are, our best and providing our best to our patients. And so one of the courses that we're recently kind of working on, it's an 8 week course, I think. We just finished week one of it. It is about case acceptance and essentially trying to learn a lot about people and psychology of us as dentists and how we can try and make our patients understand what we're saying and actually not feel like we're like selling treatment, but essentially actually uh, providing what we think is true.
You just mentioned a few good points in there. One, telling the patients what is actually there, what is true, and
Mm-hmm.
what can help them in terms of not just aesthetically, but functionally and
Mm-hmm.
structurally. That's something that patients have a hard time wrapping their head around. They just think that we're trying to upsell them procedures. And I think it's really important that we learn how to speak to our patients to convey the message. But sometimes I feel like as young dentists, it might be a little challenging. I'm a young dentist, newly graduated, 2 years out of school. You
Mm-hmm.
are a young dentist. You post out there 28, 29. I think you just turned
Mm-hmm.
29. Do
Yeah,
you feel
so
like do you feel like your age interferes with the procedures that you can do, or or sometimes convincing a
mhm.
patient of treatment that they might need?
Yeah, so I think that initially when I first graduated, that was a major issue that you kind of run into because as a younger dentist, obviously you look physically younger, but I think that there's a lot of confidence issues that come along with, being a new dentist. And so as young dentists, up until this point, when we finally graduate, we're used to working in a setting where everything that we do is checked off by a dentist, a colleague, somebody else in the community. And when you're thrown into private practice as a dentist, a young dentist, suddenly it's all your decision. It's your autonomy. It's your conversations with the patient, all of that. And so that's definitely, I think, something that's difficult to deal with when you're first graduating. But uh, I think now at this point, I'm almost 4 years out. I'm just I think a year ahead of you. Did you graduate 2021?
I did.
Okay, yeah. So I think now at this point is when you're kind of starting to settle into your groove and feel confident about the types of procedures that you can do and be able to give patients an accurate estimate of what it will be like and how long it will take and all of that kind of stuff. And so it feels a lot easier to be able to present these types of treatment plans to patients. But yeah, definitely, I think being younger is always sometimes it's a good thing because people see you as modern and more up to the times and all that, but then at the same time they also see you as inexperienced, and so it's just a barrier that I think internally you kind of have to become confident in order to get past it.
What are some ways that you can become more confident?
Yeah. So I think one of the major things is just practicing in general treatment planning and going about what you're explaining to patients. I think treatment planning is one of the most difficult things that you learn in school, especially. I mean, there's a lot of the stuff that we learn that's the detail oriented kind of things, but when you have a person that's coming in, you have to treatment plan based off of what that person's needs and wants are. And so obviously there's always that ideal treatment plan, and you want to present people with those options so that they know what the options are. But if somebody's coming in and they already have like something set in their head of what they want to do, or they have financial limitations and all that kinds of barriers that people run into, you have to treat the person and not like the tooth per se. And so giving people options is definitely important, but just practicing with different types of presentations, I think makes a big difference. I think another one is just in general for confidence things, speaking to classmates. I'm like a big proponent about when people graduate from dental school, I feel like it's a very isolating profession. And so we tend to kind of go through things without, everybody else being involved. And so we don't want to tell our classmates that we're struggling, or you don't want to like tell other people like what you're going through. And so I'm a big proponent of finding somebody within the community that you feel comfortable with, explaining like the troubles that you're going through, explaining issues that you're going through with treatment planning or patients or anything like that. And actually, Dr. Stephen Liu and I think that's kind of like one of the major things that we also connect on, is the fact that we're both young dentists, and we're trying to make sure that we're providing the best care to our patients. And so being able to honestly bounce ideas around and not feel the judgment, I think is huge, because it can be totally a lonely profession if you let it be.
I actually have those kinds of conversations with Dr. Stephen Liu. Him and I are in a chat and we constantly go back and forth about our days. Um, it's like you said, really great to have a friend who's in it with you and
Hmm.
can give you feedback or bounce off ideas. The other question that I was going to ask you is, you mentioned you just switched to a new practice.
Hmm.
Having recently graduated dental school, it seems like you're a few years ahead of me. When did
Hmm.
you graduate?
So I graduated in 2020, so I'm only a year ahead of you.
Okay.
Yep. Hmm.
So since 2020, have you found that moving between different practices has also helped you build confidence, or have you
Yeah.
been with one practice most of the time?
Yeah, so I was actually with one practice for the majority of the time since I graduated. So I graduated in 2020, and then with the whole pandemic thing, I initially started working in Kentucky for like a couple months, but I don't really count that experience because I essentially moved back like 2 months into it because of everything going on, and I wanted to be close to family. And so the majority of my practice experience was at an office that I was in Marana or Tucson area, which is where I'm from. And I feel like that's essentially where I became a dentist, like the dentist that I am, and learned a lot of the qualities that I want to be, the type of dentist that I want to be, the type of dentistry that I want to do. And it definitely was like a formative experience. In the last couple months, I decided, well, since I was doing like social media, and I've never really wanted to stay in my hometown long term, and it was never even like really like what I wanted to do in the first place. And the pandemic kind of changed that. So obviously, once things started settling down and I decided to move, family is still very important. And so I moved up to Scottsdale, and so that's only about an hour and a half, an hour 45 from home. And so it gives me an opportunity to explore like a bigger city, and more networking opportunities, and like a bigger airport so that I can travel to different places. But it's close enough to home to still feel like I'm part of like everything going on. And so definitely, from every experience that I've had, I tend to stay at the place that I'm at. So the first one I was there for about a little bit over 2 years, and then the last practice that I was at, I was almost there for a whole year, but it was just slow in terms of patients coming in and all that kind of stuff. But at the new office that I had moved to initially, like the one that I just left, I learned all about like same day crowns and CEREC and all that kind of things. And so definitely I learned something new there. And then now, obviously, at this new practice that I've been at for about 3 weeks now. And at this practice, I'm learning a lot more about a different practice style. And I'm learning more about like dental AI and more surgery things. And like I'm getting to do like the blood draws for PRF and all that kinds of all those kinds of procedures. And yeah, at every experience that you get, it's what you make of it.
Right. I'm a big proponent of that. Every experience is what you make of it.
Hmm.
And it sounds like this office is very heavily focused on CE courses and
Hmm.
giving that continuing education so you can build not only your skill set, but also have, a good and strong or stable career as a dental professional. Now that you're in this new environment and there's been all these changes, new city, new office, what does a day in the life for you look like?
Yeah. So right now, obviously, still starting, it's kind of changes, but actually, my new schedule is pretty nice because I only work 6 hour days. So I'm
Oh,
working
that's
4 days.
fantastic.
Yeah, so I'm working 4 days a week, 6 hour days, and so it's either in the morning from 7 until 1 o'clock, or it's in the afternoon from 12 to 6 or 1 to 7, depending on if it's Thursday or Friday or Tuesday or Thursday. But it's actually really nice because it gives me the opportunity. I actually have a dog, and so I either have the afternoon to come home and take my dog for a walk, or I have the morning to take my dog for a walk, make breakfast, all that kind of stuff. So I think that one of the major things that I've really started trying to incorporate again, which is something that I did in dental school, was having time to go to the gym and have like that time to yourself to really self improve yourself and make sure that you're staying healthy. So that's something that I've really been focusing on, although the last week has been kind of difficult because CE courses and moving and all this kind of stuff. But yeah, that's a typical day. If I'm working in the morning, then I'll get up, I'll let my dog out, go over to the office, do a couple of crowns, usually a lot of exams, some limited exams, whatever I can get in same day. I love the same day crown machine because it just makes delivering crowns and doing crowns in general just so much less stressful. I feel like a lot of the stress that comes from doing the crown procedure is, temporizing, the temporary potentially falling off, and then the patient coming back, and then the crown potentially not fitting, and then having to send it back to the lab. All those are issues that you go through as a dentist. And I think that the same day CEREC machine, I just can't believe I practiced without it previously. So that's really cool. And then just, of course, making time to come home, let my dog out, go for a little walk, and then go to the gym, meal prep, whatever I'm planning on doing that day. On the weekends, I love going out to eat though. So major thing. I think
So,
self care is very important for me.
I, it sounds like I have to move to Arizona because the quality of life, based on what you just described, seems amazing. Like to
Well,
have
actually,
the,
I love New York City, by the way. I used to go all the time, probably like I don't know, 4 times a year, and then the pandemic happened, and I haven't been back since. But that was always a dream of mine to like move to New York City.
well, I mean, it can always happen for you.
Hmm.
Definitely. New York is an amazing place. I'm actually born and raised in New York, so I'm a rare breed. Yeah. Like there's not many of us, but New
Hmm.
York is home and my family's here and it's a great city and I will always vouch for it. But I am looking for maybe potentially like a different lifestyle because New York can be so hectic, especially when you're
Hmm.
starting your career. There's so
Hmm.
many expenses that it just sometimes doesn't make sense to trap yourself in such a high cost environment.
Hmm.
Um, Student loans being one of them,
Hmm.
and the cost of living here, or the rent in a small matchbox is one of them.
Yeah.
So but we'll see. I mean, I've heard great things about Arizona, and what you just described sounded incredible in terms
Yeah.
of having the time to focus on yourself too. Like you have the
I was gonna
flexibility in your schedule.
I was gonna say it's pretty miserable during the summer though, so we get payback for that, I guess, during the summer, but the majority of the year, honestly, it's beautiful. Like the weather right now is gorgeous, and I'm looking outside and there's like sunlight, and it's almost the end of October, and I could almost go swimming if I wanted to. It's just crazy. Yeah.
Well, maybe I'll have to come visit at some point.
Yeah,
But
definitely.
now that you've got you have so much going on during the day. You're taking care of yourself, which is beautiful. You're going to work and you're being productive and you're learning, which is even more incredible. When you're not doing dentistry,
Hmm.
and I see you're on social media. You've got
Hmm.
this huge following on Instagram and even bigger following on TikTok. When did
Hmm.
that start? When did this whole social media presence begin?
So it's pretty funny because you say like huge following and it's totally not. Like, well, I feel like I guess when you start doing social media initially, like the numbers matter a lot. And so those first few once you start getting like the 10,000 and stuff like that, it seems like very awesome. And suddenly you start comparing yourself to other people that are doing social media and it doesn't seem so big. But yeah, when you really start thinking about it, you start thinking about what like 20,000 people means in actual people wise. It's pretty insane. And I kind of started doing that when I was still in Tucson. It was right about a year into me practicing. I started noticing a little bit of like burnout, and I was kind of getting bored with dentistry in general. Not bored, but just like I guess it's like overwhelming in general. And so I kind of had an idea. I always had an idea that I wanted to do social media. When I was in dental school, I actually was the social media chair for the American Student Dental Association, like the chapter at our school specifically. And so I was always interested in it, but again, we're bringing up Dr. Stephen Liu because he's awesome, and he genuinely was the one that kind of got me into social media. I knew him through social media. I had like DM'd with him before, but I didn't personally do social media like how he did. And so
Right.
we went to the American Dental Association meeting, and he essentially kind of got me into it. And so I started doing it and started making videos. It was very awkward at first. It's very difficult to put yourself out there and like put yourself in front of a camera and literally just talk to it and like dance and do all these goofy things. But it definitely started to increase like my confidence in general, like as a person and as a dentist. And you start getting messages from like pre-dentals and other dental students or other dentists, other people from other professions, and it definitely gives you like a sense of confidence and community. And so yeah, I started doing that and started seeing some growth, and it was like something really fun for me to do, especially with like my staff. I had younger staff at the office in Tucson, and they seemed to just be so into it, and it was just something really fun for us to do and challenge ourselves to try and make like the next viral video. But the major thing that I noticed from it was just like the increase in confidence was just you can't put a price on that. And the amount of people that you can connect with, the networking, like the whole point of like social networking was to network, and it essentially did its job. Yeah.
Absolutely. I've noticed that too, just with podcasting. It's boosted my confidence, put me
Hmm.
out there. Because you are vulnerable, you're putting yourself in a
Hmm.
vulnerable position. And then, but when you do connect with people and you see that you have like a sense of purpose, it gives you a sense of
Hmm.
purpose. And that connectivity and that connection is an incredible feeling.
Yeah, and
When,
I feel like it's a fun thing to do also because as dentists we're obviously very detail oriented. We are always dealing with other like people and their requests and stuff, and so it's like a way for us to express our creativity also and not be so 9 to 5. It's like an awesome way to connect with other people, and yeah, I just can't say anything better about it because I it's something I really enjoy.
and I love watching your videos. I just wonder, where do you get the creativity? Like constantly uploading something new, a new clip, a new dance, a new thought. Like, where does it all
Mhm.
come from?
Yeah, so it's definitely a hustle that I never really even like realized that some people actually like make money off of like social media, right? And so to be like totally transparent, I do get sponsored by like TheraBreath. That's one of my major ones, and I was actually sponsored by them, and I was excited to be sponsored by them because I actually use the product, and so I'm really picky with the types of sponsorships that I'm doing because I
Mhm.
want it to be genuine and something that I genuinely use and I'm a fan of. And so once I landed that TheraBreath deal, it was super exciting just because I was able to show the world something that I was actually super proud of. But yeah, it's definitely a hustle. It's hard to come up with ideas all the time. Sometimes I ask my staff for ideas. Sometimes I'm literally just scrolling through TikTok. Sometimes I'm in the middle of a procedure working on something, and then I get like an idea. And so
Mm.
it's a day-to-day thing. You kind of have to it ebbs and flows. Right now, I think that social media in general is becoming kind of what is it, saturated, oversaturated. And so there's a lot of creators now, which is awesome because you can basically find out just about anything that you want to find out. You can find out an expert in every field, whether it's like mortgage or it's like life insurance or it's dentistry or it's like medicine. Like you can find whatever you want to find. And so that definitely makes it difficult, but just like finding, that passion for the content that you're creating, and constantly trying to like evolve it and trying different things. I think that's the major way to continue the growth, or like at least continue making the content and not feel burnt out by that as well.
Right. I love what you're doing in terms of, being creative in the digital space. You,
Hmm.
you're a successful dentist. You've grown so much since you graduated since 2020. You've been working in different cities. Now, I actually saw a clip of you on a different podcast, and you were talking about the percentage of, let me backtrack. You are Hispanic, correct? Or
Latino, Hispanic,
it's
Latino,
Hispanic.
Mexicano.
Right. And so in this conversation, in this podcast, you actually provided the statistic that 5.9% of dentists across America are Hispanic, which I found like to be a shockingly low number.
Mhm.
And I was curious to know what that what that means to you, and were there any obstacles that you encountered being of your background when you wanted to go into dental school?
Yeah. Yeah, so definitely, so the statistic was 5.9% of US dentists are Latino. And so that statistic I think is from the 2020, so like whenever I graduated, that's from the 2020 ADA index that they had done. And it's definitely shockingly low. It's actually, I think, the same for medical doctors. So I
Wow.
think 5.9 or 6% of medical doctors are Latino. And I'm pretty sure that that statistic is even less so for people of like Mexican American origin and all that kind of stuff. And so what it means to me is that it's a huge honor and privilege to be able to represent in this space as a Latino dentist, because there aren't a lot of others that look like me and that sound like me that are a part of the community, which I think is crazy. But it kind of makes sense. When I was in dental school, I was essentially the only Mexican American student in my class, and I think that there were like maybe 5 or 6 other classmates that were Latino, some that were Cuban or Puerto Rican or whatever. And so it
Mhm.
definitely makes sense. Growing up, I feel like, uh, a lot of people of Latino or underserved, populations tend to be in lower income areas, and I definitely grew up in like a lower income area, and so my school had programs that were intended to try and help people get into college and all these kinds of things, and I think that that made a big difference in the trajectory of like where I am today,
Mhm.
because if it weren't for those people that were constantly like pushing you towards something and making it seem like it's actually something attainable, you just don't know what kind of route you would have taken, right? And so I definitely give that credit
Mhm.
to, first of all, my mom, because I had a single mom growing up, and she always made it seem very attainable, and she was right, because you can definitely make do with it. But definitely, like being low income, I didn't have access to the same schools that other people did. I hear a lot about like other people that were in my classes that would go on like ski trips and stuff like that. I definitely didn't do
Mhm.
anything like that when I was growing up. And not, that doesn't take away from anybody's achievements, because it's difficult to get into professional school in general. But definitely growing up in those backgrounds, you're more limited in the amount. Like I only applied to 6 schools, and I applied to 6 schools because 3 of them I got essentially like a scholarship to apply to 3 schools, and my mom helped me out to apply to 3 additional schools, and then of course you have to fly to different places and all those kinds of things, and those are things that now in retrospect I just think that are crazy obstacles that you have to go through as certain, depending on your background, and that might be, as a Latino student, that might be just in general as like a low income student, but yeah, for me, being able to represent and for people seeing me either on social media or just like coming in as patients and seeing me as a Latino dentist, it means a lot because they get to see somebody who can speak to them in their language and can relate to them based off of like their background. Like something as simple as like the types of like candies that I like to eat are super acidic because that's just like Mexican candies. And so
Right.
whenever people come in and they have like acid erosion, and I immediately know, I'm like, are you like eating saladitos or like lemons or like tamarindos? And they're like, how do you know? It's because I know, because I grew up in that background.
That's an interesting point that culturally you can not only you connect with your patients and
Hmm.
the way their eating habits and their lifestyle habits and it can really affect not only your relationship but it means more to them than they know.
Hmm.
The
Yep.
for someone who for someone who it has obstacles, what kind of and is trying to achieve this goal of becoming a dentist or going to dental school or maybe pursuing an undergrad in pre-dental, what are some recommendations that you have or advice you have for them in order to help them get there?
Yeah, so I think that one of the major things that you can do is just have a try to make sure that you have genuine interest in the field. I know that not everybody has the luxury of being able to volunteer because some people have to work in order to provide for themselves or for their families, but being able to get into the fields and dive in, and either whether that's like dental assisting or however it is, I think that that makes a big difference in just making sure that it's something that you want to do. Just finding a mentor, I think, is the major thing. I didn't really have that growing up in terms of like being a dentist. I always knew I wanted to be like a medical doctor, but I never really thought to do dentistry until I had done a summer program, summer medical and dental education program, which I think now is called SHPEP. Have you heard of this before?
No, I haven't.
Yeah. So yeah, just like finding programs, I think helps a lot with being able to find mentors and make sure that these goals seem attainable to you. And then the major thing is just mindset, just knowing that people are going to go through obstacles. Like I said previously, just because somebody comes from like a higher income background doesn't mean that they, you know, had it easier or anything like that in terms of like the actual workload or like taking the test and all these kinds of things. But just knowing that you can do it and just being totally confident in yourself. Trying not to have imposter syndrome is, even something that I still deal with today. Um, I think that that makes a big difference. Making sure that you're feeling confident and finding people to surround you that will bring you up as well.
You bring a lot of key points that I think a lot of our audience will actually find valuable. I appreciate
Hmm.
that. Dr. G, is there anything else you want to share with the audience that we haven't touched on yet?
Um, I would say, are people still taking the DAT? I think so, right? I
I
think
think
it's
so.
I think it's still the DAT. Well,
I
I
think
would
so.
say one of the major questions that I get from people is how to study for the DAT. And I think that the major thing that I would say is that when you're about to come in and take the DAT, I think that the most important thing is to make sure that you're dedicating your full time to it. And so that means that if you are going in and studying for it, you're studying from like 8 until 10 or whatever, and then having your little break, and then studying from 10 to 12, having your lunch break, and like treating it as like a full-time job. And so I think that, again, we were talking about not everybody has the luxury of being able to do that. But I think that when it comes time to taking any of these entrance exams, the major thing that you want to do is avoid having to take them multiple times, because it's expensive, first of all, to take them again. And so my biggest tip for people is to, whenever you decide to uh, actually apply and do it, just put like your full effort into it. And I think that you'll be successful. So
Well, thank you for those tips. I'm sure everyone would appreciate it. Dr. G, thank you so much for your time. I
yeah,
enjoyed this conversation and I can't wait to see what else you do and definitely stay in touch.
yeah, thanks so much for inviting me, and I'm super excited to hopefully continue staying in touch with you.